Good afternoon, everybody. Welcome to the Seattle-King County Continuum of Care Board meeting for the month of April. We'll go ahead and call the meeting to order here at 2 p.m. Catherine, if you would please call the roll.
Yes. Patricia Sam,
Present.
Tamara Bauman,
Present.
Jaja Floyd,
Present.
Bella Irons, Amaya Lenore, Elizabeth Moffett,
Present.
Dorsal Plants,
Present.
Ruby Romero,
Present.
Martha Sasarosi, Christina Sawicki, Victor Liu,
Present.
Amy Thomas, we have 7 members present and we have met quorum.
Thank you, Catherine. And before we get started, I just want to share, I want to thank everyone for being here today. I know it's a very busy day for a lot of us. And I really want to thank everyone for your work here on the board and all the work groups and committees. The work that you're doing now is critical now more than ever. And it's important that you show up. But I do just want to kindly remind everyone that, if things come up during the meeting, if you're, needing to go back and get called away at work, it's very important that we stay here and we stay present with each other. And so if you've got conflicts or if you've got challenges with making this meeting, or if, there's conflicting meetings and you feel like it's difficult to decide, Ruby and I are always happy to kind of help navigate those, as are Catherine and Kelsey. But it's very important that when we're here meeting together, that we're able to focus together. Ruby, did you have anything you wanted to add?
No, I think you covered it. And just that we, asked for the full attention when we're here, because we're doing good work.
Great. And so now we'll move forward with grounding ourselves and the reason why we are all here. And so if Elizabeth would read the land acknowledgement for us.
I'm happy to do that. The King County Continuum of Care Board acknowledges that we work on the unceded traditional lands of the Coast Salish peoples, especially the first peoples of Seattle, the Duwamish people, the original stewards of the land, past and present. We honor with gratitude the land itself and the Duwamish tribe. This acknowledgement only becomes meaningful when combined with accountable relationships and informed action, and is the first step in honoring the land that we today sit on and their peoples.
Thank you, Elizabeth. And Dr. Patricia, thank you for filling in. If you could read the theory of change for us.
If we create a homeless response system that centers the voices of people with lived experiences of homelessness, then we can focus on responding to the needs and eliminating inequities and to end homelessness.
Thank you both very much. Especially today, it's important to remember why we're here. Before we move on to the minutes, I did want to let everyone know that we do have a slight adjustment that we'll need to make to the agenda today. We just need to change the order of the presentations, but we would like to move the system performance presentation up and the coordinated entry presentation down, basically just flopping the two presentations on the agenda, if that makes sense. And if somebody would be willing to make a motion to amend the agenda to swap the presentations.
I move that this is Elizabeth, I move that we amend the agenda in order to put the coordinated entry presentation before the system's performance.
This
This
is
is-
Amaya. I'll second that.
Okay.
Amaya's
I
here.
second it. Dr. Patricia thirded it. If everyone is okay with doing a voice vote on this one, if you are willing to vote yes yes on this motion, if you could come off mute and say yes.
Yes, yay.
Yes.
Yes.
Thank you. If you are voting against the motion to amend the agenda, if you could come off mute now and say no, please. Hearing no nos. Oh, I see a hand.
Pardon me, I just wanted to acknowledge that Amy Thomas, Bella Irons, Martha Sassarasi, and Amaya Lenore are all here and present now.
Yeah, so let the record reflect that, please. Thank you.
Yeah.
You said Bella, Amaya, and Martha,
And Amy.
and Amy.
Thank you, Kelsey. I heard no nos. Are there any abstentions? Bella, we were voting to amend the agenda. You're welcome to abstain since the motion happened before you entered the space. Note that Bella said that they are abstaining in the chat. All right, we have modified the agenda. Thank you very much. To keep the bureaucracy that I love so much going, we will move on to adopting the minutes from the last meeting. Is there a motion to adopt the minutes of the March COC board meeting?
This is Martha, so moved.
Thank you, Martha. Is there a second?
This is Amy. I second.
Amy with a second. We'll do a voice vote again if everyone's okay with that. If you could come off mute and say yes, or if you are voting yes to adopt the minutes. Yes.
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 We got to practice that so we can all be in sync. Are there any no's? Please come off mute and vote no. Are there any? I heard no no's. Are there any abstentions? Hearing no abstentions, the minutes are adopted. And we are on to public comment. Catherine, has there been any public comment submitted in writing?
No, there has not been.
Okay. If you are in the attendees and you would like to speak to the COC board, now would be a time to put your hand up, or you can also put it in the Q&A if you're more comfortable with that.
I am not seeing any hands up at this moment. Oh, we do have a hand up. And Michelle, you should be able to come off of mute.
Can you hear me?
Yes, we can.
Okay, wonderful. Thank you. Hello, my name is Michelle Eastman. I'm the Director of Communications for the Lived Experience Coalition, and I also have a master's in public administration from the University of Washington, focusing on social policy. I want to draw the board's attention to the dismissal of board member T.T. White, and would like to encourage the board to take on public process to fill the 7 open board seats. Filling these seats is important because not only the boards lack seated membership, but the committees. I had the opportunity to attend the coordinated entry committee meeting last week, and the meeting ended early because of a lack of quorum. And as a result, important business was postponed until next month. If there had been more members, perhaps this would not have happened. And so I would urge you to consider that process and to go over that process so that we can have this process answer how will this process look for filling those seats as we move toward upcoming convenings. Thank you.
Thank you, Elizabeth. And I do want to plug that right now we do have an application posted online for our work groups and committees. And we really want a diversified voice of not just COC board members, but COC members on those boards and committees as well. So we encourage you to apply right now. Is there any other public comment that would like to be made? All right. Ruby, I think I'm handing it to you next.
Yeah, thank you. Thanks for that, Dorsal. So today we're going to talk about approving the recommendation to approve, well, we're going to talk about doing the recommendation of approving the updated rapid rehousing standards. This is some work that the cross-cutting policy work group and also rapid rehousing providers and various other stakeholders were involved in developing these standards along with Kelsey leading that project. And so I'm gonna hand it over to Kelsey to kind of go more in depth, right? About, or well, I guess no, we just would
Yeah, because we did the presentation
right. Thank you.
last month.
just refresher.
If there are any lingering questions, I'm happy to take those. But yeah.
Okay, yeah, that's right. I apologize. Thank you for giving us that update. So I guess what is in effect is a motion to approve the updated rapid rehousing standards. And if anyone would like to make that motion, this would be the time.
I motion, Dr. Sam, that the, to go forward with approving the rapid rehousing revision.
This is Tamara, I second.
Thank you. So that was Dr. Sam with the motion and Tamara with the second. Is there any discussion? Okay, can we go into, I think a roll call vote on this one would be an appropriate way to handle that. So Catherine?
Yep. Patricia Sam,
Approve.
Tamara Bauman,
Approve.
Jaja Floyd, Bella Irons,
Approve.
Amaya Lenore,
Approve.
Elizabeth Mopin, approve, Dorsal Plants,
Approve.
Ruby Romero,
Approved.
Martha Sasarosi,
Approve.
Christina Sawicki, Victor Liu,
Approve.
Amy Thomas.
Approved.
And motion passes with 10 approves.
Great. Well, thank you guys. I appreciate the approval of that. It's good work that we did today there on that. And I'm excited to see how those. All right. I think I hand it back over to you, Dorsal, right?
I think so, yes. Although I realized we modified the agenda and I'm not sure where, like, yeah.
Oh, yeah. No, that's a great
Wait.
point.
This isn't modified yet. So yeah, this one's me. Just being very transparent with the people behind the curtain today. So last month, so as was noted in public comment, we did have a board member that has unfortunately been out of contact with KCRHA staff and board members for several months now. We hope that they're well and we wish that they were well, but we've unfortunately reached a point where it's time to remove them from the board. We were in error last month and that we had just announced that we were removing TT, but that's not really a fair and open kind of process. And so instead we brought it back here on the agenda today to unfortunately ask if somebody would be willing to make a motion to remove TT White from the COC board due to a lack of attendance.
This is Martha Sassarossi. I to dismiss Board Member White.
Thank you, Martha. And I should say this is definitely a heavy motion to make. Is there a second?
This is Bella Irons, and I second.
Thank you, Bella. I'm going to ask if there's any discussion on this motion.
Yes, I'd like to just confirm my recollection. I believe we talked in our last session about the where we do have guidance in the charter about expectations for participation, and then also thinking about like our due diligence in really making all possible efforts to reconnect with our fellow board members if there are absences. And so my understanding is we've tried to exhaust all options for participation. And so I just want to check and confirm my recollection, and it sounds like there just haven't been any updates or changes in status since last month. And then the other point I wanted to raise is and this also ties back to the public comment of where we stand, and this may be an item for next month's agenda, with board member like nomination selection process and how that would align with convening too.
So just quickly, to answer the first part of the question first, there were multiple attempts made by KCRJ staff and also the co-chairs to reach out to TT through a variety of means, social media, even personal contacts that networks that we shared. And unfortunately, we just have not seen or heard anything since. And in some ways, my hope is to hear something, because I hope that she's well, but just haven't heard anything. To your second question, I know that is something that has come up a lot. One thing to note about the charter, and I mentioned last month too, so I'm sorry for repeating for those, there's not a minimum number of COC board members that have to be kept on the board. I do think that's an interesting element in the charter, and given the charter is being revisited right now, that might be a discussion there. I think part of the challenge right now, as far as bringing new people on board, is that we are in that revisiting process. And what exactly are we bringing them on to? Would we be bringing them on and teaching them the current charter, and then in 6 months have to repeat the process? Whereas if we wait for the charter to be I think we've reached a point, and Ruby, stop me if you disagree, but we should probably consider having this as an agenda item to have a thoughtful discussion openly about what this means.
Yeah, I totally agree, and I want to hear from the board obviously as well, because it's not just on our plate, but if we could make a note that we want to discuss this at the next meeting, that would be very helpful. Yeah. Thank you, guys.
And go ahead, Ruby.
Oh, no, if you had more to add, please, Dorsal. I was gonna call on Bella if not.
I was going to do the same thing, so we can just do it together. Bella?
Okay, thank you. Yes, I would like to discuss this because in the first place, my first comment is, do we need to again mention, now that we've brought this up a second time, what that guidance is for the notes? How many months or how much time has to elapse of participation, to move on to this process of, asking or having a board member step down. Want to make sure that that is transparent again in this conversation, since we've brought it up now twice, but also what you've just asked to discuss the different areas of this, because the opportunity for eventually finding out, hopefully, and doing post committee or member, outreach and not survey, but really having like a conversation, hopefully at some point for people that have been in the positions. I'm not sure if that's written into the charter, but that would be something that I would be interested in, so that there is, capture of information as to why people would transition, or if there's something more for the board and the COC to know by holding a position like that and transitioning out.
Yeah, thanks for that, Bella. So we did last year, just do a revision, and maybe Victor can share some insight on this as well, from our previous charter revision and what we had focused on, but, that was one of them, and I believe it's, in the charter under what is this? Oh, Kelsey actually put it in the chat, but for the people who can't see the chat, it just says the dismissal of a current COC board member is warranted under the following circumstances. A would be engagement in activities counter to the values of the continuum of care, frequent, persistent, and unexcused absences from committee meetings, 3 or more in 1 year. And then that's the portion, but I'll just read the following two. Breaking the COC conflict of interest policy for committee members. And in each of these cases, a supermajority vote of the 60% of those present and voting shall be required to dismiss current board members, which is what we're here doing currently. And just wanted to offer that this is one of the parts that we just recently revised that we voted on at our last Continuum of Care convening meeting in January 2025. And then I don't know if Victor, you wanted to add anything to that or not, but and Bella, if that answered your question, or if I forgot anything. Victor, go ahead. I'm sorry, Tamara, I see your hand and I just want to follow up with just one thing.
Yeah, thank you, Ruby, for sharing that, and then Tamara, thank you for your patience. I do want to share that in the last charter revision work group, thank you, Kelsey, for putting in the process for dismissal. The last charter revision work group, we actually did not look at this particular section. We were looking at membership recruitment as well as term limits, so we did not look at this. I just wanted to share that.
Thank you for that. No, I appreciate that. I just read this thing too often, I guess. I get mixed up on what we're doing. I apologize. Thank you for your clarification there. That's helpful. So it's been in the charter for some time then. Tamara, thank you for your patience. I appreciate that.
Yeah, of course. I just wanted to lift up an issue about disparities, and because Pacific Islanders are have the highest rate of homelessness compared to the general population, I want us to think about, well, why would TT like withdraw? Like, and this could be me because I'm Polynesian. So like, why would there be an instance to where somebody might not feel comfortable coming back to the table? I want to be self-reflective and self-aware to model integrity. And I think, yes, this is personal for me because I have a very special relationship with her. She's a good friend. And I just want us to be thoughtful because of how the systems can warp our minds and like warp how we like interact with each other. And to constantly be alert and aware for the disparities that are disproportionately like impacting communities of color, women, and other marginalized groups. So I'm personally like devastated that this has happened, but I understand that there's a procedure and there are like processes to follow. But again, I would just encourage, as somebody who's like the solo token Pacific Islander, like think about how we can be more inclusive and more equitable and how we distribute our resources, our funding, how we communicate. Yeah, so yes, this is personal. It's like Pacific Islanders we need to be more represented on the board and other leadership positions. So if we can like start talking outreach at some point, that would be good.
Thank you for sharing that.
And one thing I would add too, especially, with a lot of the confusion going on, it's a great time for all of us to be checking in with each other. If you know somebody that we haven't seen in a month or two at the board, feel free to reach out too. Not just Ruby and myself, or Catherine and Kelsey. We all got to support each other right now because there's a lot of people out there that aren't supporting the work that we're doing. Elizabeth, I see your hand.
Yes, on this question of board members, we had only 2 present for the convening meeting that just happened. And by keeping our numbers small, we make it much more difficult to represent all the populations. So I really hope we will take seriously the need to expand our group and not have so much responsibility on so few.
So I want to be a little bit careful here. Dr. Patricia, I see your hand. So when discussing a motion, and it's on me because we opened up a side conversation. We have a motion on the floor, and generally discussion is largely specific to the motion. I think Ruby and I have heard very loud and very clearly, we need to make time on the agenda to have an actual conversation about the recruitment piece. I don't think one thing I want to say is part of the reason why we need to discuss it is because I think we need to discuss how we get our ducks in a row. I think it's important to note, especially here for the public, that up into a couple of weeks ago, that committee, the CEC committee, was full, and so board members could not be added to that committee, whether we brought on new board members or if we had current board members. So your co-chairs and KCRHA staff and the co-chairs of your committees and work groups, Maya, Bella, Marvin, others, we have been working together to reinforce, let me use that word, reinforce our committees and work groups. And so the one thing that I can ask, and I hesitate to ask it because it's something I struggle with myself, is your trust that we are doing this in an attempt to make the committees and work groups. To Tamara's point, part of the reason I think why we lose people is there's you make time to show up to that committee and then it doesn't happen, or a committee doesn't have a co-chair for several months, and so you start to question whether or not it's a valuable use of your time. So that work is happening, and I have heard you all that we will have this discussion at our next meeting. I'm not trying to silence the recruitment conversation. It's just we do have Tom also waiting for his presentation. Is there any further discussion on the motion regarding TD White's removal from the COC board, acknowledging that this is never a motion that any of us want to make? Ruby?
Yeah, I just wanted to mention really quick before we go into this vote, just that I appreciate this discussion here today and bringing this up because it's very important that we do have this figured out collectively, because I'm hearing all of this and I also feel all of what you're saying, because we do want to make sure that we have a fair and equitable approach to this and that we're filling filling positions with representatives that we don't already have on insights from. And
Yes.
so I just want to highlight, oh, I see Patricia's hand really.
Thank you.
Yeah, go ahead, Patricia.
Don't want to, I know time is far spent. We've discussed this. I just want to echo what Tamara said. This is Dr. Patricia Sam, COC board member, and just echoing that what board member Tamara was speaking on. I want to disclose that I too have been out due to family emergencies, health, and it's been like month after month. And I'm just now regaining, coming back. I've kind of like been just frozen. But to add to this regarding dismissal of a board member, how important it is when I was going through, I just forgot, I just shut down. It was so much going on. How are we reaching out to the person? And for myself, basically, I'm just going to be transparent. This is my first hearing of that. I know we discussed a little bit about the policies and standards, but actually, it's hard for me to even to vote on this. I will know that I will abstain because how are the temps? Are they out? Are you calling? Like
Yeah.
Tamara said, Tamara is close to the person. I really can't even remember. I don't even know who the person is as a board member because I don't feel I built that relationship. So I just want to add my voice here to say that. But all in all, as an outreach case manager trying to locate people, what's going on? What is the policy? Do we reach them by phone? Do they call back? XYZ other examples. That's what I wanted to just share. Thanks for letting me add my comment.
Yeah. Yeah, and I believe that there's a belief in transparency, that I'm, I can't disclose any personal information, but what I can say is that short of going to the person's house, I feel like we did attempt, everything short of that to the, I think we're in month 5 now as, without contact and without, any sort of, and I don't really want to vote on this either, to be honest with you, right? Like this is never, I really enjoyed the time that we spent with them. I felt they were a leader and I would love to have them back. This isn't to saying that they can't apply again and that we wouldn't be more than happy to have them on other committees and work groups if they did reach out. Cause I do feel, that it's a bummer for lack of a better term. So I appreciate the full conversation we've had in regards to this. And I assure you that we will have a bigger discussion on how to make sure that we have protocol in place if there is not already one written down. And thank you.
I think that's an example of some of the work we're looking for from the charter work group. Because as Victor mentioned, that wasn't looked at yet. And so what are the, because Dr. Sam, I agree with everything you said, but at the same time, what was said by, I believe, Michelle, pointed out, that committee not being able to have quorum and meet, that's holding up work that is keeping people out on the street. And so this is a hard decision. This is not a decision that I want to make. And this is part of the reason why it should be a transparent vote in this meeting and not a decision that Ruby and I make in silence somewhere. But unfortunately, I am going to have to call the vote and vote how you feel you should vote. But we will do a roll call vote on this one, Catherine, if you're ready.
Patricia Sam,
Abstain.
Tamara Bauman,
Abstain.
Jaja Floyd,
Abstain.
Bella Irons,
Yay.
Amaya Lenore,
Abstain.
Elizabeth Mopin,
Yes.
Dorsal Plants,
Yes.
Ruby Romero,
Regretful, yes.
Martha Sasarosi,
Yes.
Christina Sawicki, if she's come back yet. Victor Liu,
Yes.
Amy Thomas,
Abstain.
six yeses and two and 5 abstains. Abstentions.
I believe that means the ayes have it.
Yeah. It's approved.
Does it take a 60%?
Of those
Voting.
of those voting.
Super majority votes, 60% of
So
those present.
are the people who abstained voting?
by abstaining from voting, you're saying I'm not. And I apologize. Maybe I should have clarified that before calling the vote. If you wanted to vote against the motion and no would be the correct vote. An abstention removes you from voting, which, as I understand it, and I don't have my Robert's Rules guidebook of all days, as I understand it, that removes you from the vote count. And so the vote would be 6 yeses out of 6 voting. I think I'm saying that right.
Okay,
Yes, 6 out of 6
thank you for the
voting.
clarification. Yeah, and just to be clear, that doesn't mean that we can't.
This
see
is
that-
Yasha. I vote no then.
Okay, I'll let the record show there's a change in the vote for Joshua Floyd from abstention to no. Is there any other changes in the vote?
Dr. Sam, no.
This is Tamara. No. Also just like solidarity.
Understood.
May I ask something though of the group? Because technically we're out of order already. So if we vote no to removing TT, which I would love to do, like Tamara, we did speak to you previously and ask you to reach out to TT, and it doesn't sound like you were successful. So if you're saying this very carefully, because there are rules. I would love to hear somebody who's voting no. Like, what are we going to do different today? Because we've reached out through an employer, we've reached out through personal contacts, we've reached out through Tamara, we've phone called multiple times, we have emailed multiple email addresses. I have sent a personal message through LinkedIn that is showing that it was, and there's no way to know for sure, but it is showing as read, but never received a response. And so I guess I am open to a no, but as the co-chairs, as your servant, what is the step you would like me to take next? Amy.
I will change my vote to yes. I have more information now. Thank you. I didn't know the efforts made in order to engage with the individual. I too have feelings about the individual. It makes me sad. I'm concerned about the circumstances. However, I understand to be a vibrant and moving forward board that we need to be able to function and move forward. And if we can't get a hold of somebody, then that's why I've changed my vote. Thank you.
Amaya, I believe you were next.
Yeah, I wanted to say, as much as I hate to do it, I'm also willing to change my vote to yes. I think that, TT definitely has a place on this board, but to move us forward, I am willing to change my vote to yes. And I really wish her the best and so much love and support to her. Literally, all that is in my heart for her is love, and I hope that she's okay. Thank you for trying to reach out to her.
Yeah. Definitely.
And this is Dr. Sam. I see it's on the agenda. I voted no. And now, after the vote, it's more discussion and more context to this. So my question would be, have we brought this up to the board members before? I hear you say you reached out to Tamara. This is my first time again being even aware of this. So it would be hard for me to just vote because I'm just hearing dismissal of the board member. I didn't hear anything and I don't have any prior knowledge of it. So that's what I'm saying. Are we talking about this and are we able to say here's a couple board members, we have not seen them, we're trying out, are we all aware of this and have we been aware? And maybe I'm just missing in the loop. That's my concern at this time. Of course, I would agree with my because of the guidelines and what's set forth. If you're saying 5 months, had I known this and things like that and been aware, then that would have prompted me to a yes vote. But that's my thought.
Thank you, Dr. Patricia. We discussed this at the February meeting. Victor, I see your hand up.
Thank you, Doctor. And then thank you, Dr. Sam, for sharing that too. Beyond the February meeting, though, I wanted to reiterate that other board members who were attending the advisory co-chair planning meeting were actually made aware of this process. So I also wanted to say that this is something that a lot of thoughtfulness was taken into consideration. It was not something that the board just wanted to do a dismissal. So I wanted to reiterate that other board members were present beyond the February meeting who attended the co-chair planning advisory meeting, were aware, and we actually had some very good discussion around that. So I just want to share that from that comment that you make, Dr. Sam. Beyond that, I'm going to bring us back to the charter that Kelsey had posted, even though it was not looked at the previous charter revision work group. I wanted to share that the charter is written as a governance charter to guide the COC board as a whole. So I just think that we, as board members, want to abide by the rules and regulations that is in the existing charter, which is of course subjected to revision annually. And efforts have already been made based on the current charter about our dismissal process. So I don't want us to say that there is no process, because the process actually exists right now.
Thank you, Vic.
Yeah, we're gonna have to do the vote again, and then we really got to move to our next agenda item. Amy has. Amy, do you still have your hand up, or is that from the previous? Okay, thank you. Hearing that was a previous hand, we're gonna go quickly into the vote. And sorry to just engage on this, Dorsal. I believe that you were handling the vote originally, so I'll hand it back to you.
Very quickly, Catherine, if you can call the roll on the vote on the motion to unfortunately remove TT White from the COC board.
Patricia Sam,
No.
Tamara Bauman,
No, I can't vote to remove a Polynesian or Pacific Islander. I just can't.
Jaja Floyd,
No.
Bella Irons,
Yes.
Amaya Lenore,
I would like to abstain, please.
Elizabeth Mopin. Yes. Regretfully. Dorsal Plants,
Yes.
Ruby Romero,
So lowercase yes.
Martha Sasarosi,
Yes.
Victor Liu,
Yes.
Amy Thomas,
Yes.
there's 7 yeses, 3 nos, 1 abstention, motion passes.
Thank you for this thoughtful discussion today, guys.
This is Amy. I have one more thing to say. I know that Victor mentioned that it was discussed in a different committee. I would like to say that if things are going to be discussed about board, that all board need to be present and that we get to have that conversation. Had I had more information prior to this vote, I would have voted differently and not taken as much time. Thank you.
That's a great point, Amy. And to your point there, I just want to say absolutely. I believe that that's something Dorsal and I are working on, is mirroring what we've seen in other committees with updates from our co-chairs meetings. And so thank you for uplifting that. I hope to rectify that for future situations. Moving us right along into the next agenda item, though. I believe is that you again, Dorsal?
It's committee reports. And so Bella, go ahead.
No, go ahead, Bella, please. System Performance Committee update.
Thanks. So communications are going relatively well. We have some new possible board members. In fact, we're looking at voting this month at this month's meeting in a couple of weeks for one of them. And we've received one of them also from the new application process. So yay, that's really good news that process is working. Please, more people that are listening to this meeting, go through our new application process so that we can bring you up to our committees and get you involved. We also have this week on Friday, HUD comment meeting. And next week we have a training And every week I send out a planning work group email to let people know that haven't attended what we're working on, any ideas or any, you know, comments or any suggestions that we're asking for. We invite everybody that wants to attend to reach out to Marvin or I or Daniel through the KCRHA to receive a link to be able to attend. And yeah, so the weekly emails are going very well. We sent out our SPC skills assessment and are encouraging everybody that is on the SPC to fill out the skills assessment so that we can possibly discuss it during our training next week. Yeah, we have a lot of stuff that's moving forward and it feels good. Thank you.
Thank you, Bella. Always great work from you and Marvin, and the rest of your team. Let's do the cross-cutting policy work group. We'll do CE last since that's the next agenda item too. How's that sound?
That sounds great. Quickly, the cross-cutting policy work group kind of did our update today with the rapid rehousing standards in a way. You know, we did finish that work. We're also getting deep diving into the written standards portion now. We're really starting to what we call piles, and we're figuring out exactly how those piles are going to be distributed into the document and just really pulling from previous or like the access that we already have to documents that are written and just trying to bring that all together into one place and cohesively put it into our written standards. And so we're making good progress on that. We've moved up to a cadence of meeting every 2 weeks, and Kelsey's been helping us out. Catherine's been present, helping us out. It's been a really great space to work in. So that's our update for now, and we'll have more on that next month. I'll hand it over to coordinated entry for their update.
All right.
Oh, wait, or does the app have an update? I'm so sorry. Amaya?
Yeah, I can give a quick update on the YAB. So right now we are kind of preparing for our first public meeting, and that's really exciting. I'm going to be facilitating that, and we're hoping to maybe do that on the 17th of April. Aside from that, we're working on our charter and also planning our convening, which is coming up in July. And we are getting a lot of engagement from our new members as well. And if there are any YAB members online right now, we have 2 seats open for the COC board. So we have our YAB COC board seat and our YAB alternate seat, which is actually the seat that I used to be in before I applied for a regular COC board member position. So if any of you are interested, please let me know. You can also let Trey know, and hopefully we can get some more YAB members involved. Yeah, that's what the YAB's doing right now.
Great. That sounds like a lot of great movement there. Always great things from the YAB. Love that. All right. Now, I believe I can hand it to coordinated entry. Thanks.
Yes.
Thanks for your patience, Tom.
Of course. 1 second here.
Yeah, no, that's fine. We had a healthy discussion before this today, so we appreciate you being patient with us.
Yeah, it's great. All righty.
Slides, these are the ones for next. Coordinated entry.
Awesome. Can everyone?
Oh, can someone confirm if you're seeing coordinated entry slides?
Yes.
Great. The way I'm sharing, it's very confusing.
And
Thank you.
Slide that over onto the big screen. For
So Tom can see it.
I got it on my computer, but then maybe for Elizabeth.
Oh,
maybe
that's
so
right.
they can
Yes.
see.
That'd be helpful.
Are you still seeing coordinated entry slides?
Yes. You went back to the front part of the screen though.
Oh, so now they're seeing this.
Oh, okay.
We're not
Yes.
seeing the slideshow.
Got it. I have too many screens. I'm going to stop sharing and reshare. Pardon me.
I don't like how Zoom doesn't give you the red box.
Yeah, green. I want
You know,
this.
Teams lets you know exactly which thing you're sharing.
Are you now seeing one that says agenda CE
Yes.
updates? Fabulous.
Awesome. Alrighty. Thanks, Kelsey. Thank you, Dorsal, Ruby, members of the board, Catherine. Hi, everyone. For those of you who do not know me, my name is Tom Regan. I use he, him pronouns. I am the Coordinated Entry System Manager here at KCRHA. I am here today to give you some coordinated entry updates. I'm going to keep it short, sweet, and to the point right now. We're just wrapping up Q1 of 2025, so I'd just like to update you all on the work plan that we've developed for 2025. Let's see, I'm going to follow some of my notes here too. So our team developed this work plan through taking a few different steps. We collaborated with our research and data team here at KCRHA, used past quantitative and qualitative analyses of our coordinated entry system here in King County. The main publications that we used being the analyses that were published in 2021. We had some more up-to-date unpublished data from our KCRHA research and data team here that we were also able to use. So on the quantitative end of things, we also used community input and feedback that we get from our daily case conferencing and open office hours, the communication and feedback loops we have with the community of providers. Our team also conducted a SWOT analysis, which is a strengths, weaknesses, opportunities, and threats analysis. And we also used like the SMART framework, which is a framework to make your goals specific, measurable, achievable, realistic, and time-oriented. So that was kind of some of the ways that we got to some of these goals in our plan. So really the big goals that we have in coordinated entry for this year are to do a kind of like thorough review of our policies and procedures. Within this, we have a few different areas of emphasis. We really want to hone in on defining the differences between agency internal transfers within project types and what we refer to as the coordinated entry mobility request process, which can facilitate transfers within the same project type, but within different agencies, or sometimes at times, as long as the programs are housing for different needs, like maybe change in household composition or increase or decrease in service need, a transfer between project types as well. We are also working closely with our research and data team here at KCRHA with the oversight of the System Performance Committee to conduct a coordinated entry data evaluation. We are also working to reconvene the population-based leadership teams. And this is something that I'm going to work closely with the Coordinated Entry Committee on. As we are able to present data to the Coordinated Entry Committee, I think it's important that the coordinating entity, our coordinated entry team, has the proper stakeholder, like robust stakeholder engagement with our community of providers to get the input on how we implement different changes in policy and procedure changes to increase the efficiency and effectiveness of coordinated entry that the Coordinated Entry Committee is kind of guiding us on. And that will involve addressing different system components like access, assessment, prioritization, and referral. So, again, really fast, just reviewing our coordinated entry policies and procedures. This is just something that should happen periodically. I am newer in my role. I'm still in my first year here as the coordinated entry manager. And with a new transition in leadership, it's obviously a good time to review these policies and procedures and see what needs refreshing and what needs update. It's also an opportunity to identify areas for discussion with the Coordinated Entry Committee. Next slide. Kind of got into this a little bit already, but looking at our mobility request process versus internal transfer, this is an area that has not had robust written policy around it available to our providers, and with just the continued expansion and lease up of new PSH projects and everything. Just the opportunity for us to provide more written guidance and support for our PSH and rapid rehousing providers on what is the difference between when they have the need to transfer their clients internally within their own agency's programs and when they need to seek outside transfer.
In this context, what does mobility request mean?
Yes, mobility request is exactly what I was just saying. So when someone needs to transfer, whether it's within a project type or different project types, but at a different agency. So to mobilize from, I am someone who is receiving housing services from the Downtown Emergency Services Center, but for whatever reason, it would be more appropriate for me to receive services from Chief Seattle Club. That would be a mobility transfer. So I am mobilizing from one.
Okay, so it has nothing to do with actually getting a person from one place to another. That was my confusion. Thank you.
Sure.
Like literal transfer. Yeah, mobility in disability context has a different meaning, so I was not clear what you were talking about. Sorry.
Sure. The coordinated entry evaluation. Oh, next slide. This is a large undertaking. You know, it's something that our research and data team here is working very hard on, you know, gathering all of there's a lot of data that flows through HMIS, you know, about everything that's going on with folks entering programs, how long referrals are pending for, if folks are exiting, or if their referrals are denied for whatever reason. You know, there's a lot there, and so we're working on it very diligently with them, and we appreciate the both like grace and patience as when we bring this data to like the coordinated entry committee and to the board. We want to make sure that it, you know, is accurately portraying really what's kind of going on within our system. Reconvening the population-based leadership teams. Again, this is something that is pretty clearly written in the coordinated entry policy and procedures of just something that is a part of a healthy and robust element of continuous system improvement. So making sure that we are getting the support, input, and feedback from our community of providers, and noticing and discussing trends on the kind of program level and system level.
When you say soliciting feedback from the community, is that the community of providers or the community of people being served?
In this instance, it would be particularly the community of providers. However, you know, in working with them, they certainly do represent the interests and voices of those whom they serve. We have other methods as well, particularly like with the public nature of our like coordinated entry committee meetings, to, you know, solicit the input from consumers, for lack of a better term as well. Yeah. Martha.
Thanks, Deb. I have a question about the evaluation.
Sure.
Because we're required to do CE evaluations? Is that right?
Yes.
Every 2 years?
Yeah,
is,
I mean,
is there explicit requirement kind of parameters around that evaluation?
Yes. Yeah, ideally, in our policies and procedures, the evaluation is an annual evaluation. It's also written in our policies and procedures that we are meant to be providing evaluative data updates every 120 days. So there's that element too that we need to get clicking on as well. So we got a lot of work to do to get there.
Okay, so it's both like sorry, go ahead, Kelsey.
Just wanted to add on to what Tom was sharing. In our collaborative application and our NOFO application we submit to HUD, they do ask us as well around annual evaluation of our coordinated entry system. How that is defined is broad. So there is a component where HUD asks us about an annual evaluation of our coordinated entry system.
Okay, thank you. Yes, but thank you for connecting the dots, because I thought that said maybe come up in that NOFO work group as well in a way. Okay, and so part of the work is like doing the actual evaluation, but then also setting whatever the kind of sustainable path forward is for these ongoing kind of updates and evaluations. Because it's been a minute since we've done an evaluation.
It has been a minute, Martha, yeah.
Thank you.
I know.
I see Tamara's hand. I just want to make sure that. Go ahead, Tamara. Sorry.
Yeah, I just wanted to the provider leadership level, like, do you guys have any plans on doing like a I guess a community feedback session for folks who are currently receiving services? Because that perspective will likely differ from how the leadership or the program itself, describes impact. Because I think what we need to really focus on now is what the lived expertise, or the folks who are surviving homelessness and moving through the system, they need to be the ones determining what success looks like and where they want to go. So I would encourage CEA or coordinated entry to do like a participant-based focus group to get that information, so that you're providing like a more equal or like a balanced assessment of what the reality actually is for service recipients.
Yeah, 100%, Tamara. I really appreciate you saying that. I think the reality of where like my team and where we are right now is that in order to even get to a place where we are prepared to undertake such kind of like a project, is we need to be kind of having our feedback loops and formal communications with the providers because any type of none of the folks on my team are direct service providers. And so they're not working and they're not holding client level relationships. And so in order for us to get to a place where we are able to facilitate those types of conversations, we also need to be able to have that stronger facilitation and feedback and planning loop with the providers themselves too. And we get that through our daily case conferencing. And there's also a need for collaborating with, our community-based organizations to be able to even have those types of conversations. Critical, crucial, important conversations like you're talking about. It's kind of like appreciate, your grace and patience with us for getting there, but it's like you got to lay some groundwork before we are able to get to a place where we could do that type of process you're talking about in a really meaningful way.
Yeah. So what I'm hearing is that we will see that in the future, hopefully, that we're working towards that.
Yes.
All right. Cool. It's great. Do you want to, is there any further questions? Or can we get through the rest of the, is there more of the slideshow?
Yeah.
Okay. Yeah. And we'll hold the rest of the questions until the end of the slideshow, if that's okay.
And then last, just, the system components. So working closely with the committee to set the priority for, how to increase the efficiency of coordinated entry. Right now, a couple of the areas that the committee is looking at is access and also prioritization. So yeah, those are my updates. Thank you, everybody.
Cool. Great. Yeah. Thank you.
And,
Oh, sorry.
no, any other questions? I think we still have a minute or two for.
I have a couple of questions.
Yeah.
So just so we all are on the same page, I want to make sure that the coordinated entry would be what is in the CFR. Would that be evaluating of individuals and families' eligibility for assistance, or is that not what we're talking about? I'm sorry, I just want to make sure, because I was trying to look at the CFR, what the guidelines were, so I could understand that.
The evaluation for coordinated entry system is really what's outlined in the collaborative application.
Oh, okay, great.
So the CFR details the need for a coordinated entry system and designating a lead, but it's really in the requirements in our collaborative application and NOVO process where detailing our evaluation is asked.
Great. Okay, cool. Thank you. So we can take a look at that. Cool. That was my only question. Thank you.
Yeah.
I'm excited to hear about it. I love you guys again.
Thanks.
Or so, or is it?
No, is Daniel joining us? Where?
One second, sorry. I of course put my agenda away. Okay, so great. So the next
We have-
thing would be the break, right? Or you taking us into the break, Dorslow?
Oh, yeah, yeah. Oh, Amy, you've got your hand up.
Sorry, let me know if this isn't appropriate for this forum, but I'm just curious, how is the forecast from the federal government and budget cuts and potential cuts to HUD that have been kind of put on the back burner from judgment? How will that affect not only our board, but the NOFO and what the KCRH is doing?
Kelsey?
Yeah. I appreciate that question, Amy. What we know right now is that grants that have been allocated for fiscal year 24, and those are the grants that begin between February of 2025 and at the latest January of 2026. Grants that have a begin date between February and May of 2025 are starting to come to direct recipients. The grant agreement from HUD is being reviewed by general counsels for direct recipients, and this is across the nation. Because there are new stipulations in the grant agreements related to gender, immigration, abortion, and previously DEI, some of that was struck from the agreement. So continuums of care across the nation are reviewing those grant agreements and what they mean, kind of evaluating that between the agreement language, executive orders that have stays, and federal law that is still law, to determine what this means, because there's not a lot of clarity and guidance around what the grant language means in practice. We locally in King County are reviewing that language. And I believe the hope is to have a kind of collective approach, particularly KCRHA and King County, who are the two largest direct recipients of COC grants. And the hope is for a kind of clear understanding by mid-April. There was also an update yesterday from the National Homelessness Resource Center around the immigration provisions and currently existing exemption information around reviewing documentation on immigration status. That I believe is going to be published more widely soon. It was an update from a webinar, and this is an update I received verbally in a meeting. So there's a lot of to be coming information, really asking legal counsel. I am not a lawyer, so I am not going to speak in any certainties or provide any interpretation that is legally the rule. So please take that as you will. But there is a lot of thoughtful attention to be there to ensure that one, money is flowing into our community in the way that we need it to, because these are funds that are vital. Two, there are not undue burdens that are placed upon recipients and subrecipients of dollars, and that there is clarity in what is required across the board. We know that at least for the grants that are set to move forward with that February through May renewal date, there is no change in what was announced to what is being granted in terms of funding levels. And we anticipate that being the same for grants with start dates from June of 25 through January of 26. Funding for fiscal year 25 is unknown. There is not clarity on funding levels, whether or not there will be a new NOFO renewal process. So there's still a lot of unanswered questions, but there is money moving and grant agreements moving. It is that legal evaluation stage that majority, if not all, continuums of care are currently at.
Yeah, and I would just like to share that there's like the COC peer sharing group that you shared with us, and that was really helpful to gain some insight at where other COCs were at. But it's quarterly, so the next one I think is coming up, but in May, so we'll have a clear picture about maybe other parts of the country and kind of what they're seeing as well, because it's good to keep informed with the other side. And then also there's the National Homeless Law Center.
Yeah.
They have presentations on it regularly, updates on it regularly, for those of you who have time to attend those. If not, I think we should be giving like an update at our meetings, every meeting, maybe as an agenda item on this, because it's a pressing issue. So yeah, that would be really helpful for me and hopefully for everyone on the board as well.
Yep. We can add a more thorough update of where we are at the May meeting as well.
Yeah, I think
And
we should.
just want to throw in there too, if you as board members are hearing things, please share that with Catherine, Kelsey, and me and Ruby as well. There's so much going on. Like earlier this week, we had board members sharing information they had about budget impacts and things like that. So please, if you hear it, share it so that there's just a lot going on right now. It's hard for one person to keep track.
Need all eyes and all ears on this right now. Changing things. Cool, great. So we've got that noted for the next meeting, and now we're going into a break, right? Is that where we're at? Okay. Great. So Dorsal, did you want to handle going to the break, or should I just handle it since I'm already mentioning it?
Just two quick announcements, or two announcement and plug real quick for the break. One, just a reminder to the board members, just because we had a lot of discussion, the upcoming co-chairs meeting this Monday is the extended meeting, with the intent being that it is open office hours for staff. I'm seeing a look from Catherine. Please correct me if I got the date. Okay. If you have questions for KCRHA staff or the co-chairs, Monday would be a wonderful time. We are available by email or phone. Please reach out. But Monday is our extended hour-long meeting for that purpose. And if you're in the attendees and you are not currently serving on a committee or a work group, we do have an application available. And while we are on break for the next few minutes, it'd be wonderful if you wanted to apply to one of our committees or work groups. And we've got a 5-minute break, so let's go ahead and come back at 3. Can I round up to 3:20? Is anyone gonna be upset if I round up to 3:20? Let's
Sounds
be back
I
3:20.
second that.
See you at 3:20, everyone.
Christina is there.
Okay, so if you've all heard that the Friends of Useless
Thank you, guys. For board members, if they could come back on camera just for a brief time, to know that everyone's back. Awesome. I see Amy, Victor, thank you. Dorsal, see you. I think I'm here. There's Elizabeth, great. Cool, camera's back. Awesome. Seeing enough. We got everyone's camera on except for a few, so let's go ahead and get started as we are crunched on time now. Let's move into the next presentation from Daniel Ramos, who's from the Community Impact Team. And he's going to discuss the system performance measures and what they mean for us.
Yeah, just
Dan-
can y'all can hear me?
Yes.
Yeah, I'll speak loudly and clearly and stop me if for some reason you can't hear me. Daniel Ramos. Oh,
before
yes,
we
Ruby.
get started, Daniel, sorry to interrupt you so soon, but before we get started, it is on our end at least a little broken up. Maybe it's the camera. Sometimes I know that maybe if you go on, I don't know. I'm so sorry.
Let's see.
Okay, let's see if we can hear you better now.
How about now? Any better?
Oh, yeah, actually, yeah.
Okay, great. Well, the good thing is, I'm not here to show myself, but actually to show you some important data. So, I'm happy to be here. Deanna Ramos, he, him. I identify as Chicano. I work with KCRHA as the data asset manager for the newly renamed Department Research and Data at KCRHA. And I'm going to give you, well, here are the goals of today's presentation. I'll start with there. Really, I'm going to before you information about our system performance measures report. This is actually a multitude of reports, something like 11 reports that are put together and given to HUD each year about system performance. But before I do that, I just want to share with this group that we have a federal reporting calendar. And I don't know when was the last time you all saw this, but this is that timeline for us each year. And I thought it was important for you to see the location of the system performance measures in that, typically due in May, as it lines up with our other federal reports. And I'm happy to take questions about this particular reporting calendar at the end of this presentation, as some of you might have some questions about it. But this is the basic outline of our federal reports that the COC is beholden to. So what I talked to Kelsey and Catherine about before this presentation, I think it's important to say is I don't have, my approach here is to try to improve data literacy around this report. And so I'm leaning more into what this report measures. I'm going to be talking about that. I actually would invite questions in real time. I think we're crunched with time, but if you're compelled to ask a question, I'm happy to answer it. So we're going to focus on measure 1 and 7, and I'm going to give you last year's comparison of the system performance measures. A quick note about system, what that word means. I think this is important. When we think about projects or project performance, program performance, we want to know, does this shelter get people into housing? How many exits did they have for permanent housing? One project can be doing really, really well at that work, and we see a lot of successful exits. Sometimes we get to the system level where we look at that one project and say, yes, those households are exiting into permanent housing, but do they show back up in the system? That is where we get to that systems level thinking, where we're not looking at one project in isolation, but are folks moving around throughout the continuum of interventions. I'm focused on measure 1 and 7. This is really a task in data literacy. I just want to make sure this group importantly understands this. So measure 1 and 7, this here on the left-hand side are the primary measures of the system performance report. It looks at length of time homeless from project start and exit date. Really what you're looking for there is to measure efficiency. Typically, that's what people will talk about here. Is that throughput happening in a longer or shorter? Exits to permanent housing. Is the intervention working? Are they exiting positively? That could be that may be up to the client on what they feel is positive, but HUD has a prescription on the destinations that it considers positive. And we'll go over that. First time homeless is just the first time that we see them make contact within our system. And that means a record created in the HMIS. Returns to homelessness. This is an important measure, but it's really only looking at a window of 2 years. So within a 2-year time scale, has the person entered a project, exited to a positive destination, and then later returned? I chose my words carefully there because they have to go to a positive destination for it to be considered a return. Otherwise, it's just a continuation of their displacement. Income growth and employment gains. This is really looking at, did this household leave better off than when they came in terms of their income? And that could be earned income, that can be Social Security income. So let's imagine a permanent supportive housing case manager gets someone on that Social Security disability and they're receiving that income. That's a positive thing. That's a positive thing. And we measure that at entry, a year into their stay, and a year exit. And if they're in a program for multiple years, we're checking in every year to look at that. Those are all the measures, excluding two that I want to dive in more carefully. So we'll look at those ones at a later date. Today, we're going to be looking at permanent housing and return. I incorrectly highlighted return. We're looking at length of time homes. Apologies for that.
So I saw your hand go up. Did you put it down? Sorry.
Thank you. Yeah, I've got questions about the re-enrollment data, but if we're going to talk more in depth about returns to homelessness, I can wait to see if it's covered. Thank you.
Yeah, first of all, that I think that one's also one I want to stick a fork in, but I think right now I'm trying to sequence this for the next federal report out that I do. Measure 2 will need time to carefully go through all of that.
Sorry, I don't know if it's just me, but you're starting to cut back in and out again, Daniel.
Right, again. Okay. How about now? A little bit better?
That time was better.
Okay. So this is measure 1, length of time person remains homeless. Really, this one, if you want to look at it, it's measuring the time between them entering into homelessness and the time that they enter homelessness. And we measure that in a few different ways.
Daniel, yeah, sorry, it's not good. Love you, but it's really hard to hear you, and we can't quite capture what is being said for the captioner. And so I need you to talk maybe a little slower and probably directly. I'm so sorry.
Does it sound like a connectivity issue, like internet is?
Yeah, it kind of cuts in and out. It's not warbly or anything. Yeah.
I think it might have to do with my internet connection and not volume. Let me see if I can just swap out.
Thank you. Yeah.
1 minute, and I think I can.
And I think we can take a quick break until that happens. Because I want to make sure.
And the Q&A, person here from the Coalition to End Gender-Based Violence, I saw the same thing where it's popping up and saying there's a slow connection or something. Hey, Ruby, should we do community updates right now? Just real quick.
Oh, yeah, that's a great idea. While we get that figured out, because again, this is important. And just, quick pause on that. Community updates. I just wanted to inform everyone that does work with direct services or works with people on the ground, that Metro is requiring fare again, and so just to make sure that everyone's aware of that, they can access Orca cards if they receive EBT or cash assistance with EBT. I believe it's either free or very minimal cost. That's one option. I believe there's other service providers like perhaps Reach. Don't quote me on that, but I've heard through the grapevine that Reach does provide Orca cards, or there's other programs that do. So please make sure you encourage or help our people experiencing homelessness how to get fare so they don't violate any rules. Yeah, and anyway, great. Is there any other community updates? I see you're on, Kelsey.
Yeah, would love to share in this space that the Seattle King County Coalition on Homelessness is doing a training with Northwest Immigrants' Rights Project on immigration and custom enforcement training. That will be April 8th, Tuesday, April 8th, from 9 to 11 a.m. So I just wanted to share that here. The end. Cool.
It's posted on our website.
Yeah, and they'll be posted on our website, is what I heard from Catherine here. Great. That's good. What we didn't include in the, is Daniel ready to go? Okay, great. Daniel, you ready to go? And thank you for your patience, everyone. Thank you for that, Victor.
Oh, I need to elevate Daniel back.
Oh,
so he can speak and join. Daniel, you should now be all ready and set.
Hi, y'all.
Mm.
I'm hoping that connection is better.
It's actually not any better.
It's not better. Man, I switched out my network to see.
It sounds like it's better, but it's just more muffled, if that is helpful.
Like you have cotton in your mouth.
Let me see something.
How
about now?
Oh yeah, that's it. Yay. We can hear you
Better?
loud and clear.
Okay.
Yeah.
I'm getting a nod.
We can hear you. You're good.
Okay. So measure 7. Oh, excuse me, measure 1. Let's go through this. So I know time is short. So length of time between 2 points. You can do entry exit if they've only been in one program, but if there's multiple programs, the logic here is going to take into consideration those multiple program enrollments to get that overall length of time. And really, again, we talk about throughput, efficiency, and I mean that in a neutral term. If you're trying to get people through shelter more quickly, from a 90-day to 70 to 50 incremental improvements, this is the data point you'll want to be looking at. And here we go into some of that calculation. Again, I don't expect you all to be experts on this. HUD has poured a lot of thought and consideration on how to do this. And again, this is HUD's measurement. And this one has several parts to it. This measure 1A, it does not, 1.1 does not include transitional housing. 1.2 does include time-scale transitional housing. And I think that comes as no surprise because transitional housing can be up to 2 years typically. So by including that, you could minimize if you don't tease them between shelters and transitional housing. So 1A, uses those dates between 2 points. 1B is looking at when a person says they became homeless. which is the data index number is 3.917. This is the their last, the date of their last prior residence. And so this is real data. I will say that we're going to be publishing to HUD this year's 2024 system performance measure for measure 1, but that's not due until April 11th. And so we're still finalizing that before submission, but I will have those numbers out shortly for you. So what we're doing is comparing the last 2 years. And for those of you that might have any questions, the report period here is October 1st to November 30th. So we're always lagging behind a year. I know that's a little counterintuitive, but we need a full year worth of data before we report on it for the next year. So in the yellow column, you can see where it was in 2022 and where that length of stay went in 2023. I know there's probably some points of discussion here, and I'll go on for time's sake. Measure 7, here we have successful housing placements. Talked about this a little bit at length in the beginning, so I'll move to the next slide here. Again, this is the formula in layman's terms. How it pulls it from the HMIS the code is quite complicated, but this is, I think, an accessible way to understand that. Where you take in all of those program participants that exited during that time frame, and then where did they go? And here you can see we did have some positive exit changes. And I think what's important here is that for COC funding, that has remained pretty stable over time. So when you look at a number where we have an increase in positive and successful exits, the KCRHA took on these grants within that time frame, and you can see year over year we are seeing improvements in those exits with the same amount of stable funding that was received in the previous year. And I think that's just important to highlight, that you're getting more for the investments we're putting in. Here, this gives you the total count, so you can see the universe in which we group this, and then of those who got into, who had that positive exit. And there's a note on here about data quality. This is why the data management team and the research and data team is so important. We work day in and day out with providers looking to see that those enrollments are accurate. We have data quality standards that are enshrined in our HMIS data quality improvement plan. That's on our website. So you can see that we really are trying to, we do work hard to provide technical support, and where we need to hold agencies accountable to the performance that we hope that they can achieve, and scaffold them through that and support that as much as we can. I'll stop there. I know we're over time, and so I want to be respectful of that.
Yeah, thanks for that, Daniel. We have a question here in the room. Elizabeth?
From SO to PH, what does SO stand for?
Daniel, you're on mute. What does SO stand for? I believe it's street
outreach.
Yeah, thank you. And yeah, is that your question?
That was.
Okay, I had a question about, how do you think that does the live inventory play into this at all? Does this help it at all with our counting? And just like our system performance, I'm just curious if that plays into it at all.
Can you say the first part of that?
Sure, the live inventory count, because on the system performance committee, we've done some work with a possible launch of the live inventory count, right? And so I believe we've done that. And I was just curious if there was any data from that was collected for the, if it helped at all with collecting data for the system performance measures. And maybe I'm totally off, and if I'm off, then I apologize.
No, I don't think you're off. Where the live inventory is really important is with our housing inventory count. That's the companion report to the point in time count. So how many folks are on the streets and in shelters, and how many beds do we have? The live inventory is more of a question of um, using that data to inform the housing inventory count. And I think there's more there. I can give you some follow-up context, but the relationship to this is really minimal or none at all that I can see.
Great. Thanks for that clarification. I see Dorsal's hand.
Thank you, Ruby. So I'm curious. So I know at least for a portion of 2022, HUD was considering staying with friends or family as exit to permanent destination based off of the amount of time that you were able to stay with friends and family. At the time I was doing HMIS entry, it was 90 days. If I could get some form of communication from that family that that family member could stay there for 90 days, I could say that they had permanent housing, which is not, I feel, an accurate report. What's the current standard? Is staying with friends or family still considered a HUD permanent destination? And what documentation is required by HMIS to verify that that person actually can stay there for more than 90 days? Thank you.
Yeah, that's a really, really good question, Dorsal. So there's two destinations. There's to friends and family, permanently and temporarily. So those are two distinct values. If they select the one that's permanent, that is a successful exit. If it's the temporary, it is not. And that's as plain spoken as that logic is. I think the other part of your question is the length of time. Was it related more to the verification of it? Yes.
Well,
it is
yeah.
self-report. It is self-report. And there was some old guidance that's no longer on HUD's website, but there was some older guidance that was, if the case manager has some supporting documentation or knows, they can update that. But we really, really encourage that rapport building so that they can get that data collection. The other thing, Dorsal, and this is nothing about your comment, but just generally speaking, I think we have to just be careful because it's slippery slope when we start to question self-report. It sort of undermines the validity of the people that we ask to tell us what they're experiencing. And I know you know that. I just don't want to give the impression that self-report is less than documentation.
Well, I do believe, and I'd be happy to provide documentation of my position, but as far as rating data accuracy, self-reported data is considered lower than other forms of data because of some of these concerns. And so what I'm saying is I have lived experience as a provider. Kelsey, I see you really want to, like, I have lived experience as a provider of people telling me that they have gone to stay with their family permanently because they were frustrated with services. And then I saw them sleeping in their car driving home that night. So yeah, the entry in HMIS was permanent and it was self-reported, but that family's still out on the street.
Dorsal, I think that's an excellent point, and this is why a system performance level report is so important. Because if they show back up in the system, we'll catch them in measure 2, for example, which is really taking a balcony view of how this works.
But as I would love to dive into, but we're not talking about that data metric. I myself, as a provider, called KCRHA's data team and said, HMIS is showing that I have 0 returns to homelessness. This is inaccurate, and I can provide documentation that's inaccurate. And I was informed by KCRHA that, nope, it's a 0. It counts as a 0. There's no way to change this data. And so I think part of this conversation that's lacking that we'll need to continue is that return to homelessness data is in of itself challenging and problematic. If I am a DV survivor who entered a program under a confidential HMIS profile, there is a chance that you will not know that I have returned to homelessness because I couldn't get into a DV shelter the next time I got into Mary's place. And Mary's place didn't ask me to de-identify or didn't ask me. I shouldn't have. I'm just picking on a random person, but I think the return to homelessness data point is one of the most challenging data points in all of HMIS. And I struggle with focusing on the permanent housing placement without having a conversation that there are major limitations to the data about returns to homelessness.
Dorsal, I couldn't agree more with these kind of scenarios and cases happening. And I don't have a line of sight on how frequently they happen, but we're in a good position with HUD's open comment period to elevate those concerns. Also, I know with the System Performance Committee representation on the COC, I think this is an appropriate task for them to look into our data collection practices at the provider level and give some recommendations to make that improvement, because we need to make improvements as you pointed out, and that's how we have really strong measures. Now, in the absence of that, what do we have? I think that's the kind of the hard place that we're in. If we don't use this, what do we use? And I think for now, we've got this. We have to make those improvements, and then over time, we can have that reliability I think you're hoping to have, Dorsal. Yeah, I think with that, if there's any other questions, otherwise I do appreciate everyone's time.
Yeah,
I think Christina has a
she
question,
does,
right?
yeah. And Christina, please, let me know if I'm not asking this correctly, but I believe Christina wants to know what happens to a family if they come back after 2 years?
In the data, it looks as if it's a new episode of homelessness for this report.
Okay. And I
That's
also.
if they exited to a positive destination.
Mhm. Right, thank you for
Thank
that.
you.
We'll double check if that's to clarify for Christina, if that's what she was asking. I had a quick question. You mentioned something about, if we could go back to Dorsal's question, you mentioned, you guys were talking about something that needed to be maybe into like a written standard or something. Was that what we were just kind of discussing? I'm sorry, I wanted to make sure that I captured it. Dorsal, can you clarify again just what you guys were discussing?
So the challenge with, as I understand it, and you know, brought up a couple of times, the challenge with the return to homelessness data point is it's dependent upon you going to another HMIS data entry program, and that program accurately entering your profile into the system, or agreeing to enter your profile in the system in the same way that it was entered at the other provider. And so if I enter the system and they put Dusty Roads as my name because I didn't trust them, and then I go to my shelter program and I check in as Dorsal Plants, that is a potential data error. There are a lot of them that come around, like the de-identified, and so there are other states that have countered this by getting very into the weeds around what de-identified profiles do. Another solution that was slightly attempted here, but it didn't gain traction, was issuing check-in fobs for people checking in at services that opted into the program, so that you could see a DSE at one point had an ID card that functioned kind of similarly, but like ensuring that there's a way that that person is the same person throughout the system. And that was the reason why I had 4 returns to homelessness in 1 year, but they never showed up in HMIS because they didn't go to an HMIS program next. And that would be another way to fix it, is if KCRHA's data team had allowed me to self-report that, no, there are returns to homelessness from my team. That would be another solution.
And I love the solutions orientation you have on that, Dorsal. I'll just add that one of the nice things about our community is we are using respondent driven sampling for our unsheltered count, and that's where I think we would hopefully be able to pick them up, not Dusty Roads particularly, but in the estimates. And I think that's just another shout out, I guess, if you will, or plug for the unsheltered planning work group, that they're gonna that instrument, that methodology is hopefully gonna pick up that family that we don't see back in the returns data.
Yeah. If I may as well speak to Dorsal, one thing that you're sharing, particularly around the data literacy piece. Another part that would be beneficial to our community and data users is some literacy around identifying duplicate profiles. There is an annual process that BitFocus does to review and merge duplicate profiles. In the 2 years I was working in like doing referrals to housing, would scour HMIS for duplicate profiles to ensure that we were getting like full, complete, accurate histories and sending that to BitFocus. So having some like technical assistance to providers around merging duplicate profiles, how to identify if a profile is duplicate, so that we do have as clean and accurate data as possible. Another kind of checkpoint that we have in our system, at least for our COC funded programs, when the annual performance report is due to HUD, KCRHA does an initial data completeness check to look for errors, so that programs can review any incomplete data to ensure that there is as much accuracy as possible. And there's a couple times in the year where that is asked of for providers. So having those like ongoing checkpoints helps to minimize that. It's by no means perfect, and definitely could call for just more kind of how-to guides in that regard. So that may be something to bring to BitFocus.
And yeah, just to follow up on that, as the System Performance Committee member, I do believe that we go over a deduplication process during our review of our standards, I believe, and correct me if I'm wrong, Daniel. And then also this is a good opportunity to talk about the well-being, metrics that we really gotta get going, so we can start to evaluate at a more person-centered level rather than a program-centered level. So thank you. Is there any other questions or comments? There's a question in the QA, which is, are there any numbers on those who are homeless and receiving services but not in HMIS in King County? And I believe maybe Daniel could probably answer better than I could, honestly. Have a theory, but he's still with us. Oh, he might have had to.
Oh, he might have.
Okay, he had to leave, but I think there's an answer for that, and we can follow up off of.
I can share a little bit. It not as accurately. The way that we try and capture this is through the point in time count, to get information on that. If anyone is receiving services that are receiving public funding, that is required to be documented in HMIS. So if there are any services that are being offered that is based on private funding, those aren't necessarily captured in HMIS in King County. There are kind of continual efforts to bring in as many providers into HMIS so that they are reporting those services. But there's not a funding requirement to do so. So there are not always the incentives for organizations that are not receiving public funding that requires it to do additional data entry into HMIS, as those services may be being recorded in a different database. So there could be duplicative entry, which could be an administrative burden. People need funding to be doing that. And there's not always You know, if they're not receiving the funding that's tying you to do the data entry, those incentives are hard. So there's, it can be complicated and challenging at times. But that is a bit of what I can share at least.
Dorsal, I see your hand, but I just wanted to also clarify, there's the HMIS beds in the housing inventory count, and then sometimes they look at non-HMIS beds in the housing inventory count. Correct. That's another way to look at it. Dorsal?
Just really quickly, Kelsey, and if I need to ask Daniel, I can send him an email. But what about across lines? So if I exit a family to permanently stay with their family in Spokane, Washington, they get there and they get immediately kicked out. Can KCRA, I know as a provider, I could not see anything outside of my own system, but can KCRHA see that's a return to homelessness if it's not inside of King County?
No, we don't have that level of data sharing agreements across the state. The data sharing agreements are all local. And I the end.
Yeah. I think
Because
that's
that would be another challenge for the return to homelessness statistic is, and that seems like it would be fixable because you can see the zip code. So anyone, yeah. I'll follow up with Bella and Marvin.
Yeah, I think that's a great point, though. Thanks for bringing that up. So is that the end of that agenda item? That since Daniel is no longer with us here at this moment in time. I believe I put the agenda away. What is we're done. Well, so we're gonna do the community updates because we did not give any of the meeting times for the next meetings during our community or during our boards and committee updates, or did we?
No, I don't.
Jaja's got her hand up.
Oh, I'm so sorry, Jaja. I did not see that. No, yeah, thanks.
It's easier for me. I don't know, typing, it takes a long time. Anyway, my question is about HMIS, Kelsey. HMIS, is that a way to track people who are homeless? And if everyone who's homeless, are they in HMIS? Yay or no? No.
Yeah.
And you only get in HMIS if you self-report.
No, so HMIS is the system used to track services that are provided with public funded dollars. Not everyone experiencing homelessness in our community is accessing services or supports from a provider or an organization receiving public funded dollars. So not everyone experiencing homelessness is in HMIS. That is one of the flaws of just data systems. Our setup of HMIS is not accessible for individuals experiencing homelessness. The data is done by the service provider entering that data or the organization entering that data. I know there are systems and hopes to create portals where individuals or households experiencing homelessness can access information. That's a whole different type of system build out to have that kind of an interface. And we know from a lot of the kind of outreach work that is done in our community that it is through consistent street outreach where we see people who have been experiencing homelessness for many years who might not enter HMIS the very first day they're experiencing homelessness. It may be that they have been for 10 years, 3 years, 3 months. It can be at whatever point in someone's experience where they encounter an outreach worker or another service provider and consent to have their one, engage with that provider, and 2, have that engagement tracked then in HMIS.
Yeah, and
that's a long-winded answer.
No, that was great, Kelsey. You did a great job. I would also encourage anyone that wants to learn more about the HMIS system. We do have the System Performance Committee, and again, that brings me back to our dates conversation as to when we've got more meetings coming up. So we've got that training that you mentioned for immigration services on the 8th of April, I believe is what you mentioned. That's on the website. Yeah, thank you, appreciate it. And then we've got the, this is more of a reminder for those of you on the work group, the cross-cutting policy work groups on April 14th, I believe is our next meeting. That's a Monday. And then the SPC or System Performance Committee, which does handle the oversight of HMIS, is going to be on April 16th. That's a Wednesday from 2 to 4, the third Wednesday. And then governing board, April 17th. I'm just going to read it off like bullet points now. Also a reminder for the committee members of the charter revision work group, it's on 4/18. So we hope to see you there. And oh, the coordinated entry committee, our favorite one, thank you for that report out today, is on the 24th of April from 10 to 12. And I hope that the board members that are on the committee and the members of the public are joining. We'll see you there.
What was the 16th?
The 16th is the SCC. And I think that would bring us into the adjourning of the meeting. Thank you guys for the thoughtful conversation today. Thank you. Bye. I guess our next one though, I didn't tell us that. What?
FCC, federal communication.
Sure.